Thank you for joining us for a roundtable today, Connecting Health and Home. I'm happy that we're all here today and that everybody was able to log in okay and join us. All right, so, based on our experience at Legal Aid with litigating and working to address substandard housing and living conditions that violate the law, we know that having secure housing makes all the difference to individuals and public health. The pandemic certainly put a spotlight on this interconnection and brought to the forefront statewide and nationally what this means for everyone. We saw elected officials and local leaders stressing the importance of everyone having a safe and secure place to call home, federal and state governments passing eviction moratoria, and doing everything they could to ensure that families and residents could remain housed and thereby slow the viral transmission. But even before the pandemic emphasized the imperative of having a safe and secure housing, those living unhoused experienced higher rates of hospitalization, medical emergencies, and injuries. Joining me today to discuss these connections further, the connections between health and home further, are Dr. Donna Beardman. She's on faculty at the Duke University School of Nursing, where she directs their Community Health Improvement and Partnership Program. And her interests include homeless, transitional care, and healthcare utilization of unstably housed persons. Also joining us is Madeline Moriali. Madeline is a managing attorney here at Legal Aid. She's the manager in charge of our statewide medical legal partnership, which integrates access to legal remedies in clinical team-based efforts to address social determinants of health, enhance health equity, and improve patient and community health. We also have Denise Lockett. Denise is an attorney with our Elder Abuse or Senior Law Project. She's been with Legal Aid since 2017 and is a UNC School of Law grad. And also here with us is Carolyn Battle. Ms. Battle is a former client of Legal Aid who currently serves on Legal Aid's Client Counsel Advisory Boards. Welcome, everyone. And I'm happy that you all have been able to take the time out of your very busy schedules to join us. Just a quick housekeeping note before we jump right into the roundtable. We want this roundtable to be as engaging as possible. So please feel free to put any questions you may have in the Q&A box. We'll pause to answer some of those questions during the discussion, as well as provide an opportunity to take live questions as time permits. And we'll do this either during the roundtable or after our panel discussion. Okay, so let's jump into it. And Ms. Battle, I'm gonna start with you. As a member of our client council, we value your wisdom that comes from personal experience. In Roanoke Rapids, where you live, it's a community built on a former trash dump, as I understand it. And the proximity to that sort of waste obviously has health consequences. What were some of the health effects experienced by your community that you can speak to? You're muted, Ms. Battle.
We are living on a dump, and we also are close to 3 other waste sites. So with that, we have a lot of disparities in our community. We have a lot of cancer, respiratory problems. I've had family members who passed of myeloma, trying to heal some of the things in the air, you know, in the ground. And we have our kids who lack proper health care. We have our senior citizens who are having a lot of trouble with breathing problems, and then we have, and now when you're in a poor community, we're open for substandard housing. We have a lot of housing that's not suitable for our people. So when you look at it, so that in itself is a big health risk. We don't have proper heating and our water. We do have city water, so that's one of a good thing for us. But a lot of the community here suffers, and we have um, drug infested neighborhood. We have children that don't have an outlet to play, and then when we started the gardens, we couldn't get them to grow because of so many things that we found in the ground to try
Right.
to plant. So we had to start to raise garden beds so that we could grow healthy vegetables. When you dig, you're always finding glass cans, all kind of things in the ground. So it's a lot going on here with that. And I know that it affects our children with their learning process. It affects
Mm-hmm.
teens as well. And then we have people here that a lot of them not high school graduates that don't have income, so they don't have good health care. So it's just like you're in a box
Yeah.
and you can't get out. So those are a lot of the things that we were facing. So we started this community center in 1990 so that we could try to help. And we've been blessed to do some things, but we haven't had a lot of funding. But what we do have, we provide to our community.
Thank you for that. Definitely a terrible situation down there in Roanoke Rapids. Um, what would you advise communities to do when they know they live in conditions comparable to Roanoke Rapids? And was there anything in particular? I know you mentioned the community center. Was there anything else in particular that you did to fight for healthier live-in conditions?
Yes, we've tried to get Lincoln Heights annexed into the city limit. We are only a mile from the city of Roanoke Rapids, but that has not yet happened. We've reached out to people for soil and water testing. We've also talked to, I'm trying to think of his name, and I could have said it if I hadn't thought about it. But we've got in touch with agencies in Washington, D.C. We've talked with the Conservation Fund, who has helped us. We are trying to get our soil tested again, and we had started that situation before COVID, and so it's been put off until the situation get better. But we have really been doing a lot of coming together. One thing, you got to come together, get a plan, and go forward with it. And it's not easy, but it's something that just has to be done. And
Mm-hmm.
when people know that you're serious about what you're doing, they'll listen. And I'm not going to tell you how fast they're going to turn around, but they will listen. So we've reached out to a lot of people, and we have a former um, member from Roanoke Rapids that he's a professor at Georgia Tech, at Georgia College, State College, who's going to come down and do our soil testing after the COVID breaks. So we got some things in place. But the best thing I can say for anybody going through this is to just form a plan and come together and stick with it so that you can prosper.
Thank you, Ms. Battle. Um, I'm gonna, and what would you suggest for individuals, if they wanted to advocate for themselves or their neighbors, what would you suggest are some steps that they could take?
Well, we've met with the mayor or the governor here. Um, we started you get one complaint and you just have to follow it through. So we started with the city of Winter Rapids and then forwarded their senior year, and from there you go on. And it's in one complaint. And once you do your paperwork and you get the community to sign off on it, you get more. But if you are one person starting it, and to get others involved in it that's live in the same community, you'll get more action.
Mm-hmm. Okay. All right, let me bring some of our other panelists in. You know, based on the situation in Roanoke Rapids described by Ms. Battle, and even with the COVID-19 pandemic, the connections that we've heard between health and home seem very apparent. Could each of you address the importance of having a safe and secure home to good health? Dr. Beardman, do you want to start us off?
Yes, I'd be happy to. Thank you. So I think that a lot of times when we think housing and health, thinking about it in the individual level problem, right? So if I have a house today, what does that mean to my health? I think, as Ms. Battle said, it can become a community problem or even a major public health problem. When I think of housing and health, I think of homelessness has contributed to a hepatitis A outbreak in more than half of the United States. More than half of the United States has an active hepatitis A outbreak, and that's because of humans coming into contact with other human fecal matter. If you're homeless, you don't have a place to toilet yourself. There's no bathroom. So sometimes that's done in kind of a more public setting, maybe behind a tree at a park or something like that. And then also there's no place to wash your hands. And so homeless persons not only and they don't have the opportunity to wash their hands and protect themselves from becoming victims of like hepatitis A or even COVID. With the COVID outbreak, that really was a major issue when you had all the fast food places closing down and all the restaurants and the mom and pop places where a lot of homeless people would go and be able to use the bathroom, be able to wash up a little bit and stuff. When all those places shut down, there was no place, no place for hand washing. Major public health issue by not having adequate housing for people.
Yeah. Madeline or Denise, do you want to add to that?
I'll just add, this is a round table, and so I don't want to get wonky here, but we really don't need a lot more evidence to prove the connections between housing and health. I think there's just a deep, long history that the connections between we spend kids 90% of their time indoors, and most in their own home, particularly for younger children, and when they're being exposed in their own homes to things like cockroaches and lead and all kinds of other things that no one should ever have to live with. The effect that has on not just emergency use, emergency department use, or preventable admissions to the hospital, or missed days of school, work for the parents and the caregivers. It's really a long litany of things that if we pay attention to housing conditions and the quality of housing that people live in, those investments will carry us a long way to better outcomes for individuals, families, and communities.
Yeah, I couldn't agree more.
I would concur with that. I mean, it is, I think we've already mentioned the importance of a holistic approach to services for individuals who are inadequately housed or homeless. And I think that they're really hitting the nail on the head with this discussion, because we look at the fact that, many people have multiple issues when they are inadequately housed or unhoused. Oftentimes they suffer from other chronic conditions that preceded the situation. They've had inadequate health care maybe for years. This is exacerbated by the poor conditions. And then you have, as Madeline pointed out, young children growing up in these insufficient or even, harmful environments. So you've got exposure to lead, toxins, E. coli even, when you have inadequate sanitation. So I think that there are numerous impacts that are lifelong impacts. So the sooner that we can address the issue, improve the issue, ameliorate the situation, the better. And that's why it's important not to work in silos. That's why it's important for organizations to come together, for public policy to be structured so that we are as effective as possible in addressing the issues earlier rather than waiting for the negative impacts, which are far costlier, than addressing it early.
And speaking about policies, at Legal Aid, we're concerned about the potential end of the eviction moratorium next week, right? Which we know will inevitably lead to more eviction file-ins and in turn escalated rates of homelessness. But that word homelessness, it means so much, and it means so much to different groups, right? So with the threat of homelessness and the ramifications of homelessness, how would each of you define homelessness in terms of your areas of expertise? Madeline, why don't we start with you?
Thanks, Sharia. It's a really important question. No one can overstate the significance of the end of the eviction moratorium. So many people who are incredibly housing insecure, facing the possibility that they may not have a roof over their head, and the destabilization of their work situations, their ability to access services, their ability of their children to stay stably schooled where they want them to be. You just can't overstate it. The definition of homelessness, I think, is sort of an interesting paradoxical question to me, which is, is the point of asking that to screen or identify people who may need additional assistance, or is the definition something that sort of triggers eligibility for certain kind of services? To me, homelessness, the better phrase when it's about how can we best help people, is a combination of housing insecurity and a broader frame of access to safe and affordable housing, right? Because they're so interconnected, the quality of housing and the availability of affordable housing, right? So we've got, there's certain metrics, like a significant proportion of North Carolina families pay more than 50% of their income on rent. And there's a big that low-income people are either automatically eligible for and receiving subsidized housing. By the way, a teeny tiny percent of those who are eligible ever actually get subsidized housing assistance. But more importantly, there are a whole lot of people who live in really bad housing conditions. They can't go somewhere else. They're sort of trapped. So there's folks, our folks are one sick day away, one paycheck away from being imminently homeless. And there are a whole lot of folks who don't ask for their landlords to take care of things because they're worried that if they make a complaint and they don't understand the North Carolina laws around retaliatory eviction, that they won't have anywhere else to go. And that's really the significance and importance of people understanding their rights and their options. And it connects to other things. I'm getting a little long-winded, broadband access to transportation, access to all kinds of other services is connected to people. I'll stop there.
Just, I'll go ahead and say, usually when I think of the definition of homelessness, like Madeline said, I automatically go to the HUD definition because that's connected to services. And as a nurse and as somebody who's thinking about health and trying to get services, so I automatically just default to the HUD definition to try to get services. Also, as Madeline says, people have this assumption just because you're low income means you have some type of access to a housing subsidy. I think they have the same impression that just because you're low income, you're Medicaid eligible. We are a Medicaid non-expansion state, and Medicaid does not pay for housing either at this point. So as a Medicaid non-expansion state, if you are living in substandard housing or you are homeless and you are becoming sick from it, many of those folks are not insured. So these are people that have no type of medical insurance. So anyways, back to the original question, I tend to default to the HUD definition because it's about service connection usually in my arena.
Yeah, so just briefly, I kind of concur with what Madeline said. To me, homelessness is not necessarily just lacking a roof over your head. You could have inadequate shelter. So I was thinking of a couple of folks that I know, senior citizens who lived for multiple years in housing where they didn't have regular access to heat or electricity. There was a significant plumbing problem with one. So you're bringing a bucket to make your toilet flush. And there's vermin, other kinds of infestation, snakes. So I think when you have places where housing is unaffordable, you've got a really short housing supply. And again, this was such a crucial point. There is this misprision, this misunderstanding by many members of the public that if you're poor, you get free housing. It is just not available. There are 2-year, 3-year, even 5-year wait lists, depending on where you live when you're trying to get subsidized housing. So I think looking at this as a very pervasive problem, when we're defining homelessness, I think it's important to see that the scope of the problem is broad enough that sometimes there's basically what we would term a constructive eviction, because the standards of the housing are so poor, it's basically uninhabitable housing. Even though the client's paying rent regularly, it's almost like being evicted because it is really not fit to live in.
Yeah.
I concur with everyone. I've seen it where the senior citizens who are on oxygen, living in homes with kerosene heaters, that's not healthy at all. When you look at the children that are living in houses with holes in the inside of the walls, and 5 kids in 2-bedroom houses because that's what they can afford. Then when you look at the houses are old and they're dilapidated, and the people who rent them at a high expense, and they can't afford anything else. They can't provide services for their families. So I see it all. So I think with everyone else that it's a broad problem, and it's something.
All right, so what do you think, based on these various definitions or understandings of homelessness that we've discussed, what do you think they reveal about federal, state, or even local policies? Anybody want to take that one?
I would say,
I'll do
I'll
something
start
really-
us off. Oh, go ahead.
Go Donna, go ahead.
I would just say, to me, it reveals that there's everybody operates within a silo within these very defined, tight definition.
Mm-hmm.
There's not a lot of overlap. So when you're considering like the social drivers of health, for instance, like housing, we say housing is a social driver of health, but people rarely make this type of connection between health and housing. So I think that it just really clearly indicates that we still have our operational silos and we're not doing enough cross-pollination.
Yeah. Yeah.
I have a short addition to that, which is there are, of course, other definitions of homelessness, Tenevento for eligibility for services for children who are homeless, the definition of homeless for folks who might be seeking services from community health centers that have healthcare for the homeless programs. There's all kinds of definitions. And I think part of what they failed to do is recognize, because they're when it's about eligibility, you need something clear, right? Who's in, who's out, but they've on the whole failed to recognize the instability of people's lives. Today I'm housing, I'm not homeless, but tomorrow I might be. And that sort of fluidity of life experience, which means you don't get something depending on the day you're asked, is very challenging.
Right. Yeah. Switching gears just a little bit, Denise, you mentioned evictions and constructive eviction in particularly. Practically, if someone is facing an eviction, what could a legal services attorney do And Ms. Battle, I'm going to also pull you in on this question just to share maybe from your personal experience what you think would be most helpful. So Denise?
So one thing a legal services attorney can do is to try to level the playing field, because we're able to litigate on behalf of clients who wouldn't otherwise have representation. So it's not like this, it's more this, right? And in the course of litigation, a lot of what we do is educate our clients about their rights. That can help us defeat the eviction. Sometimes we can even get money recouped for them if they've been overpaying and the conditions were really substandard, through a doctrine called rent abatement. And so we advise people in many ways that will shore up their ability to make their claim, to make their truth known about the inadequacy of the housing that they've been in. We help them with documenting the conditions. We help them with getting, on occasion, an expert witness. We advise them to bring their medical bills if they've had negative health impacts. So we can help them present the real story in a compelling way. And we also educate magistrates and judges about case precedent and written laws that match what's going on, and defend that client's rights. So I think that can really turn things around for individuals, and for communities, because especially if you've got someone who's sort of a repeat offender landlord, or there's been misinformation in the community about tenants' rights, many people don't even know they have a written law that's protecting them as a tenant, or they may not understand that even if they have an oral contract, they have definite rights in terms of living in a habitable and safe location. And so I think these are things that are very vital services, and I'll let Ms. Battle talk.
Well, I agree with you, Denise. The biggest thing we do here is educate. And then when we let people know what's going on with legal aid and educate them, some of them will do it and some of them will not, for the fear of getting put out because they're going up against their landlord. So it's that fear factor, and they don't trust the system enough to know that they'll be safe if they go forward. Now, the education is out there, and when they call us, we make sure that they get the information. We just have to try to coach them to go further with it. But I agree with Denise.
This time I'm going to pause to see if we have any audience questions. And if you don't mind, I'll throw those out to the panel if we do have some. All right. Are there any local governments looking into funding tiny home communities as a temporary transition from homelessness to land home ownership? Does anybody know of anything in the community?
I do believe, and I am not positive all of the entities involved, but I know in the Buncombe County area, there's a movement around tiny homes as being a solution for the very tight housing crunch in that region. So I have heard of that.
Okay. All right.
I was going to mention, I know in Pittsburgh, there is a tiny housing community that's being developed. It's, I believe it's 15 or 18 tiny homes. But it's not that transitional. You know, I don't think it's intended to be a transition point. So from tiny home to home ownership. And so that's a very specific question about transitioning. Some people will go to tiny home as a rental, or I don't know if some could have an option to buy a tiny home but maybe not go on to home ownership.
Okay. Dr. Beardman, there's a question here for you. You mentioned HUD, and according to the definitions of HUD, families in hotel and motel living situations do not count as homeless. Can you or anyone else on the panel discuss the repercussions of living in hotel and motel situations and the potential solutions?
I would say the hotel motel depends on who's paying for it. So if you are paying, and I've known homeless people that have done this, pay for your own hotel room. So you're panhandle every day to make enough money to pay for your motel room that night, you are not considered homeless. However, if a charity is paying for your hotel or motel, you are considered homeless. So it's really about who's paying for it. That's why we really recommend that people not do that, that people not pay for their own hotel rooms, because then that would either be considered a break in homelessness. Maybe they've been homeless, unsheltered for 3 months. They get enough money that they get a week in a motel. Once they start paying that motel, that was a break in their homelessness. And so we really recommend that people do not pay for their own motels because that will jeopardize their homeless status.
Okay. Ms. Battle mentioned the fear factor. So the question is, how do we help clients overcome this fear factor?
Yeah, so definitely, I think education about retaliatory eviction as a defense, and also educating them about how you present the evidence, how you document what's been going on, what would be relevant and supportive of that kind of a claim. And so I think the fact that I did want to mention, Cherie, even though we can only serve a small percentage of the eligible clients, that live in North Carolina, we do offer a lot of free information and education through community education clinics, through our Facebook Live, through our website, and then there's also the Law Help site. So I really hope that individuals can avail themselves of those sources of education and information, so they don't just go on rumor or misinformation about what their rights are to adequate housing. And we also, some of these clinics, they're educating landlords as well about this is your obligation. Chapter 42-42, it spells out what you need to do. This is the minimum. These are the things that you need to attend to for the health and safety of your tenants. And so we provide that education across the board. And I think that's an important resource. And people need to be secure in the knowledge that they do have enforceable rights. And as a landlord, that you do have enforceable obligations to meet standards that are statewide.
All right. What's the outlook for new Medicaid pilot programs that can help with housing and other social drivers of health? Madeline, do you want to start with that one?
Yes, and I apologize, I keep dropping my video. I've got sound stability issues. This is really an exciting area of policy changes that are in the works in North Carolina. As part of the Medicaid transformation, there's a significant additional new expansive responsibilities for care managers to identify and address unmet social drivers of health, including housing, interpersonal violence, transportation, and food insecurity, among other things. Within the Medicaid waiver, there's a separate thing called the Healthy Opportunity Pilot Program. And the awards for that were just made about 10 days ago. So in 3 regions of the state, there's $650 million to enhance service delivery in those 4 key domains. And within housing, what that means is for Medicaid enrollees who are pilot eligible, living in those pilot funded counties, they may be eligible for things like move-in support, remediation services paid by Medicaid, security deposit assistance, assistance to access to legal information about their rights and options, healthy home goods for cleaning supplies. It's a long list of things that Medicaid, for the first time at this level, depth and breadth in the history of the country, we're going to test out whether if we invest Medicaid dollars in those kinds of things, we'll actually see better outcomes and lower costs.
Okay.
Provide additional information later.
So there is a question here about how is a person's health impacted by a writ of possession? And Dr. Beardman, you have done research into adverse health effects experienced by Durham Housing Authority residents who have experienced a writ of possession. And in that research, you identified over a 5-year period, 258 heads of households that received this writ. 97% of these residents were African-American and 80% of them were women. Could you summarize some of the results from that study with an attention to what it shows about the types of medical issues experienced by these residents, including hospital stays and outpatient visits?
Yes, I'd be happy to. I get to say, first of all, medical diagnoses are complex. And so the way we categorize them is with a thing called an ICD-10 code. And so when we looked at the types of medical diagnoses people had, we did have 258 people in the study, but we reduced that size down to 152 people because they had to be within our medical record system within a certain date. And then they had to have pre and post eviction or writ encounters in order for us to see what was happening. And so our total number ended up being 152 for the study. But before eviction to after eviction, the chronic top 7 diseases. So these are the top 7 diseases defined by the CDC as costing the most to individuals and society. So this would be things like cancer, diabetes, heart disease. And so we saw a 42% increase of people with those diagnoses after eviction. Chronic other diseases. So these could be diseases that are chronic other diseases that are not considered within those top 7 defined by the CDC. I definitely saw an increase in those, about a 34% increase. Acute illness and injury, saw a 30% increase in that. And then mental health issues. So these are diagnoses specific to mental health. We saw about a 60% increase in that. The one really interesting finding on diagnoses that we found were there was a 60% increase on people seeking preventive care too. So this would be like well healthcare visits, going to, immunization or screenings, things like that. We were interested, we found that a very interesting finding, and just feel that maybe people are trying to connect with social workers in a healthcare setting. And perhaps that was what led them to seek healthcare. As far as utilization data, the number of total hospital admissions increased substantially. So before eviction, there was of the population of 152 people, there were a total of 115 hospital admissions. After eviction, there was 271. And then ED visits, also a very substantial increase, went from 517 before eviction to 930. So we had other things moved, but not they weren't not statistically significant. One last thing that we did in the study, we matched the folks that were in the study within the local HMIS system. So the HMIS system is the data system that people that are HUD funded or service providers that are HUD funded use to track their clients. And so we defined people that entered the HMIS system as people that became literally homeless. And of those, it looks like 34 of our 152 people ended up in the HMIS system, and those were primarily families. So the vast majority of folks in the study, as you mentioned, were African-American women. And so I think that this really has the potential to demonstrate how health disparities begin, through the lack of housing or the inadequate housing, being evicted. And then we see the increase in these types of diagnoses and hospitalization rates.
So short of ending all evictions so that these health effects that you mentioned are never experienced, is there anything that can be done to ensure that residents who are facing a writ of possession or about to be removed from their homes do not experience these health-related issues?
I would say, these health-related issues were going, for many people, were happening prior to the writ, right? And so I think that goes back to maybe housing quality or living in poverty. So if you're in public housing, you're living in poverty. And I believe that that's really where we have not paid enough attention. So what does it mean? Why do I have substandard housing, or why am I living in public housing? Why am I at risk for homelessness? And it's the whole low income poverty area that we don't adequately address in our country.
Okay. All right. So, Denise, how does research like this help to shape what we do and who we serve at Legal Aid?
Oh, it's helpful because it rings true to our lived experience, and we can see the connections in a broader kind of, in a holistic way. I think that the data confirms the importance of the work that we do to prevent the evictions and to improve the housing conditions. I think it also points out, because our client base are the most disadvantaged among our communities, and having this additional data point, this academic information, it helps us be more interdisciplinary in how we work with that client base. It helps us be more effective. Hopefully gaining studies like this that show the long-term impacts that are, the negative health impacts of homelessness. I think that will help us better make a case for the need to have thoroughgoing change. It's a public policy issue, but it's also an advocacy issue. We are able to cite papers like this, sometimes in closing arguments or in appeals to get funding. We can talk about how important the work is when we're trying to keep people safely and stably housed. And so having this kind of academic information, it's vital to doing more effective work with the dollars that we have. And I think it's a financially sound approach to use, as Donna said earlier, we don't want to be in our silos. We want to use this information and work as teams and build effective mechanisms such as the medical legal partnership, so that we're addressing these things in a thoroughgoing way. But it's great to hear that what we have been seeing or suspecting all along, now we've got something more precise to present the picture to the rest of the world.
I'm going to ask one last question before we get back to the audience questions, because I see quite a few coming in. But Madeline, piggybacking on what Denise just said about interconnections, how does research like this help us to understand the interconnectedness between housing and safety and all the other social drivers of health, such as lack of access, transportation, food stability?
Oh, thank you. There's a lot in the literature. There's sort of a lot of common sense that can come to answer this question. The relationship between housing insecurity and food insecurity, it's the heat or eat, or the treat or eat, or the pay your rent or eat. They're just deeply connected. And there are studies out there that look at, the relationship, among adults with chronic disabling conditions, the rates of food insecurity and the rates of med compliance, and then the multiplicative factor that both of those have on health outcomes and stability. So, a family that is trying to make a decision to pay their rent or pay their utilities or fare to get to work, it's the same pocket of money, and then just difficult decisions are made every single day by the families that we represent, the people that we're trying to help. And you can't disconnect access to transportation from all of this, right? If affordable housing is so far away from jobs, that people have to rely on transportation, that's a life changer. That's a game changer. So there's just no doubt that people who are housing insecure or like living in bad housing conditions, it's sort of this tsunami of all of the other things that little daily decisions have to be made all the time as to how to prioritize very little funds.
Okay. And Dr. Bierman, if you have anything to add while I pull up the questions, feel free to do that. I'm going to start asking audience questions.
I actually did see one of the audience questions that was addressing like if you don't recommend people pay for their own hotel rooms, what do you do recommend? And I recommend in Durham and in all areas now, there should be a place called coordinated entry. In Durham, it's called Entry Point. So if you're facing homelessness, getting connected to Entry Point and getting in the service system is the path out. For people that are panhandling just enough to make that motel payment, that is not a sustainable solution. So not only is it not sustainable, but it's actually making them less eligible for other resources. So to the person that asked that question, as hard as it may be, not recommending people pay for their own hotel room, getting organized or getting connected to organizations that may pay for that for you.
Okay. All right. So let's jump in here because we have quite a few. What are we talked about the multiple legal definitions of homelessness. And the question is, how does this impact the work of a community health nurse? And Dr. Bierman, do you want to take that one, given your background?
So I think the multiple definitions of homelessness do increase complexity. For instance, there are nurses that work in schools, the school nurse system, and the Department of Education has its own definition of homelessness, right? So you would define a child that would be considered under the Department of Education to be homeless, and then you try to connect that child's family to resources, and you find out that all the resources are HUD funded, and so HUD doesn't really consider that family or that child homeless. So I think that from a community health nurse perspective, understanding that landscape is really important because it's not that it's not a frustrating journey already, but just understanding what these different definitions mean and how to navigate that.
Okay. Would it be advantageous for any of the larger healthcare organizations to fund affordable housing? And are they? Anyone?
Quickly, yes, they are not here. So if you look outside of North Carolina, I can't say not here for the entire state, but I can say that in Phoenix, Arizona, United Healthcare actually bought a couple of apartment complexes and are housing their homeless or unstably housed people there. It's happening in Chicago, it's happening in Seattle. So many healthcare organizations are realizing that providing housing is cheaper than providing emergency department visits, and also definitely and better for their enrollees. It's better for everyone.
Okay. Denise, there's a question here for you. I think you have seen, you've seen some forced homelessness for older people from their homes because they're unable to make necessary repairs, including hoarding situations where the home becomes a health hazard and adult protective services becomes involved. It seems like few resources exist to help older adults in these situations, yet it has a dramatic impact on their health, both physical and mental. Any suggestions from the public health experts on situations like this? And Madeline or Dr. Bierman, if you want to help Denise with that answer, feel free to jump in as our residents' public health experts.
Yeah, I would love some help with that one because it's been super frustrating. It feels like it's a patchwork approach right now. So if y'all have guidance about that. And a lot of it depends too geographically where the individual is living in terms of what's available, because notably in a lot of rural areas, there are faith-based organizations that may help. There's also APS can try to help coordinate some assistance, but typically it's a little bit catch as catch can in terms of what resources are available right now. So if y'all have a more precise answer, I would love to hear that.
I can't speak directly to that specific question, but as far as helping people age in place and ensuring a safer environment for older people, there's a program that was originated in Baltimore called Capable. And we're trying to establish that program actually in Durham. And it's going to take a little while. I believe it's in High Point or Greensboro right now as well. But this partners a nurse, a handyman, and an occupational therapist to go into an older person's home, assess what the barriers are for them to do what it is that they wish they could do, go outside, whatever, bathe by themselves, these things, and then make those repairs to that home, whether it be installing a handheld shower and making the shower more handicap accessible. That is a Medicaid, or excuse me, a Medicare covered expense in some areas.
Oh, well, that would be wonderful if we brought that statewide. How does the fluidity of the live-in situations impact children and their interaction with the educational system? Anyone can jump in.
I wish Jen Story or our ACS colleagues were here. I want to connect this not only to the question of housing instability in the context of homelessness, but we haven't mentioned the word foreclosure. I just want to make sure we all talk about this. You know, many low-income people live in owner-occupied housing and are at risk of homelessness or housing insecurity because life circumstance makes it difficult for them to make their mortgage payment. Just for those of you who don't know, that's part of what legal aid and legal services advocates do, is to help people stay in their homes when they're at risk of foreclosure. But back to the children question, which of course means both renters and homeowners, family. Yeah, I can't imagine the strain that's on families when they have to move their children from the services that they are counting on, from not just the teachers, but all of the people in the schools, you know, special education services and all kinds of assistance that's where they live and which school their child is enrolled in. And for those of you who want to sort of connect it to bigger stuff, you know, think about what happens when natural disasters occur. And, you know, children and families are displaced or suddenly can't get access to the things that they've been counting on. That's not a very elegant answer. I think Jen or Hope or somebody else on our staff would have done a much better job. But I think that what this really all is about is sort of, we can't do it on our own. You know, we need to bring the best of our expertise and our professional licensure to the table. But we need to work with, you know, folks like Dr. Biederman and other collaborators who are all working for the same purpose and bringing different skill sets, financial resources, and otherwise to the table to get better outcomes on behalf of our shared patients, clients, our shared community neighbors. And to me, that's sort of the biggest theme here is lawyers should be part of the team. And a lot of folks outside of our profession don't know that we have something to bring to the table. But we can't do it. We can do a better job when we've got someone like Donna or the care managers or the social workers or the pediatricians who help us get those IAPs.
All right, once the client is referred to coordinated entry, who follows through with the clients to ensure they find transitional housing, and what is the time period of process from beginning to placing someone in housing?
It's a complex equation on how people are prioritized for housing. And so it's not necessarily a first come, first serve. There is a prioritization process in each COC within the state. So that's the organized effort to house people. There's 12 COCs, I believe, in the state. And Durham has a COC. The Durham COC's responsibility. The Durham COC and most COCs likely have a website. So I know the Durham COC has a website that you can go to and read more about that process, but it is complex and evolving actually nationwide as we look for better ways to prioritize people. I think that there's a medical vulnerability that comes into play. I did want to tag along to this idea of us working together, though. Another way I've seen legal and healthcare working together recently is about people that are leaving the criminal justice system or are criminally involved and working healthcare providers writing letters to judges, helping lawyers understand, like, if this person is incarcerated, their congestive heart failure is going to get worse, or because you keep on racking up all these court fees because of these non-appearing arrests, you fail to appear in court, so your warrant is issued for your arrest, and then a fee is associated with that. So providers have been writing letters, and really it's been very helpful for people that are involved in the criminal justice system.
All right, and this is a kind of giveaway question. What legal resource would you refer people to find an affordable legal representation? It's usually very difficult. So I think I'll answer that one. You can definitely contact Legal Aid of North Carolina. You can call our helpline or go online. Our helpline number is 866-219-5262, and we could put that in the chat box or for you as well. So here's, I'll take maybe a couple more questions. I'm just monitoring the time. COVID has forced many households to combine into small dwell-ins. How are the rights of these lessees impacted when household members are added? Ms. Battle or Denise, do you want to, what happens when, family members have to move in, and we saw that with the pandemic, right? People trying to shelter in place moved in with other family members, and now you have tenants and household members who may or may not have been on the lease, but they needed a safe place to live.
So generally, they should have the right. The family should have the right to live together. I guess sometimes we get into advocacy issues when there is subsidized housing and there might be a restriction or a need for a modification based upon that change in number of residents. So what we tend to do is advise people to get up with us sooner rather than later if there's been a household change like that and they think it might impact their leasehold situation. We do a lot of negotiation and discussion, and I did want to mention, Dr. Biederman reminded me of this kind of tacitly in what she was talking about. We do reasonable accommodations work sometimes, and that can involve having a household member who's available to help care for another family member. So adding that person to the household. So I think there's a lot of it that could be fact dependent, but generally we would advise if there's specific questions that you do reach out for the free legal assistance about the specific situation. And also if there are, one other thing I wanted to mention about reasonable accommodations, in terms of conditions and health effects, I'm just going to mention an example. I had a client who had specific negative pulmonary impacts because of a condition that she had, and she needed some accommodations for having extra space in her household, which normally she wouldn't be entitled to with her subsidized housing setting, but we were able to secure that for her. It gave her space for a special air filter, and she could have someone come in and stay overnight if she needed that person to help make sure she was safe. And so there's a lot of things that we can assist with, but again, some things are very fact specific, so I would hope you would reach out.
And here's an interesting question, and I'll throw this one out to anybody. Why should we care about homelessness? Why should taxpayer money be wasted on people who habitually demonstrate an inability or lack of desire to improve in themselves? Should funding for housing be more selective? So why should we care about homelessness?
Say, I'll start us off with, I would say even if it's not, you know, it can be self-serving. I care about homelessness because I don't want to get hepatitis A. I care about homelessness because, you know, and I mean, that's not me personally. I care about homelessness because I don't want to see my neighbors suffer. And seeing human suffering affects us all. It affects us all mentally, it affects us all physically. But even if it's not me, and even if that's not my driving force, so I don't get a communicable disease because of people that don't have housing. I mean, you could certainly be self-serving on this.
Well, I would like to say so many things come into play when a person is homeless. We on the outside looking in. We don't know how the situation, and we don't know, and we tend to just justify our faults instead of getting to know what the problem is and getting involved. And that hurts America as a whole because we don't come together. Am I my brother's people? Yes, I am. We're supposed to be. So when you got your brother homeless, then it should be some way that we should be able to help.
I think that was very eloquent. And I just wanted to add on, I can't remember the name of the study, but Matthew Desmond, who wrote Evicted, there was a study not long ago that he and there were two other authors, sociologists, but they showed that the bang for the buck is extraordinary. When you invest in stable housing and you take people out of homelessness, you save on lots of other expenses because there is less need for medical care. They can get regular employment. So I think the housing first approach has been shown to work.
Okay. There's some suggestions in the chat that we didn't get to about some housing solutions that somebody suggested using 3D printing to construct homes and what or thoughts were on that. And then somebody else suggested taking a look at van life. Van life is a form of adventure tourism that includes a van that is livable and self-sustained, and it can access remote areas. And what they do is convert vans and box trucks and ambulances and that sort of thing to create housing as another housing solution. So thanks for those comments as well. Looking at the time, I think we have to wrap up. So before we go, our panelists, if you have any final thoughts to close us out, we'll take those now, and then we'll end our session today.
This has been a great opportunity, and I really thank you for the invitation. I know that there was a couple of questions about the paper that I referenced, and if I'd be willing to share that paper. It's actually in press, so it hasn't been published yet, but I will certainly share it with legal aid, and then if you could go ahead and share it with participants from today's meeting, that'd be great.
Okay.
The work of lawyers is part of collaborative efforts to reduce disparities and promote and enhance equitable ways of organizing our lives and spending our money and setting our priorities, just, you know, to address causes of poverty and bad health. you need to look at issues like discrimination. You need to look at who does and doesn't have access to services and what can be done about that. And sometimes equity-driven strategies require different kinds of investments, not investing equally and expecting that equal investments are going to achieve equal outcomes when people aren't starting from the same place.
All right, I would like to thank our panelists for that discussion. Thank you to the audience who participated. We appreciated your comments and questions. I'd also like you to invite you to our next session. We have Jean Nichols, who will be presenting at our next discussion scheduled for July 29th. Please go to our Facebook page, our Legal Aid Facebook page, to get more information about that presentation. Again, thanks to our panelists. Thank you for everything you've done in the work that you do. Ms. Battle, thank you for taking the time to share your personal experiences and what it's been like living in Roanoke Rapids. I think you added a very practical, useful dimension to the discussion. So thank you for that.
Thank you for
Thanks
having me.
everyone, and enjoy the rest of your afternoon.